Can COVID is an open science collective dedicated to rapidly mobilizing and sharing knowledge to help inform Canada's COVID-19 response. To learn more about us or how to join our community, you can visit our website at cancovid.ca.
Okay, so I think we'll get started. Hello, everyone, and welcome to this week's edition of Can COVID Speaker Series. Thanks for joining us today. My name is Rosa Stalteri, and I lead the knowledge translation team here at Can COVID, and I'm also your moderator for today. And I do have the pleasure of introducing you to this week's speakers, Dr. Mayvis Rebeira, who is a lecturer at the Institute of Health Policy, Management and Evaluation at the University of Toronto, and Dr. Eric Nauenberg, who is Associate Professor, also a chair within Health Economics Department at the Institute of Health Policy, Management and Evaluation at the University of Toronto. And our title for today is the consideration of trade-offs regarding COVID-19 containment measures in the United States. So just a few things to note. We did save time for a Q&A session, so we welcome you to ask your questions into the chat box, and we'll go through them at the end of the presentation today. So without further ado, I'll hand over the mic to our first speaker, Dr. Rebeira. Thanks.
Hi, thank you, Rosa, for the introduction. Hello and good afternoon, everyone. I'm very pleased to be here, myself and Eric, to present this topic. This topic is really an analysis, high-level analysis on the consideration of trade-offs regarding the sweeping containment measures that were put in place to control the spread of COVID in the beginning months of the pandemic. And the focus of this analysis is on the United States. As everyone is aware, in healthcare, interventions are rarely justified just in terms of life saves, but also a myriad of other trade-off factors, including value for money and cost effectiveness. So this study is intending to be a high-level overview, and it's really meant for to stimulate discussion and perhaps more concrete methodologies that can be derived based on this analysis. So as Rosa mentioned, both myself and Eric are affiliated with the Institute of Health Policy, Management and Evaluation at the University of Toronto. And we are really pleased to be here to present this piece of work. So as an overview of our presentation today, I will go through the purpose, a bit of context behind the study, trade-off consideration, cost, high-level overview of the method, results, and Eric will then step in to do the discussion piece. So let's go through the purpose of this study right now. So really our intention was to do a possible economic evaluation of COVID-19 containment strategies, including shelter-in-place orders, using existing methods and early data. The focus is on the United States for this particular study, and the intention is not really to provide so much as a definitive answer, but really for discussion purposes and to build on existing methods, but perhaps interested researchers in Can COVID network can build on this kind of research to using more advanced and innovative methods and recent data. As you will know, trying to do any kind of economic evaluation on large-scale stimulus packages is a real challenge, especially in the early months of the pandemic, when data wasn't very strong, not available. The pandemic was moving at the spread of COVID was moving rapidly, and many decisions were being made in very quick order just to control the spread of COVID. So a little bit of context on this study. When you look at the deaths from previous pandemic, right, they have a wide range. Like, for example, the 1918 Spanish flu reported deaths were around 50 million, and the more recent 2009 H1N1 reported deaths were around 400,000. When you look at the recent epidemics, for example, SARS, I believe there was only about 744 deaths worldwide that was reported, and MERS, the Middle Eastern Respiratory Syndrome, another epidemic in 2012, reported around 862 deaths worldwide. For COVID-19, as of March 21st, in the US alone, we are having close to 80 million cases and 972,000 deaths, which is nearing 1 million deaths in the US alone. Worldwide, there are 6 times more deaths, 6 million deaths worldwide, and 470 million cases of COVID-19 cases worldwide. To put in perspective, in Canada, there were 3.4 million cases and 37,000 deaths. So COVID-19 took everyone by surprise just by the speed at which it was spreading, the highly contagious nature of it, and the number of deaths it was causing. So to control this rapidly moving contagion, stringent containment measures, including shelter-in-place orders, were put in place. And this included social distancing, masking, travel restrictions, quarantine, non-essential services, closure of non-essential services, public venues, school closures, and many other shelter-in-place and many other containment measures. To give a recap of the timeline, just to put this study in perspective, really, after the first case was reported to WHO on December 31st, WHO declared an outbreak as a global health emergency on January 30th. By January 31st, the US has stopped allowing any foreign nationals who were in China in the past 2 weeks from entering the US. The first reported death was in February 7th in California, but the more often reported death was really end of February, that was in Washington state. Fast forward, but March 11, the US has banned all travelers from 26 European countries. CDC issued its first restriction on March 15, and by March 27, the first stimulus package was put in place. By April 7, 95% of Americans were in some form of lockdown. Quickly that became lockdown rallies, anti-lockdown rallies on April 20th. And you fast forward, by the end of that same year, FDA approved its first vaccine, Pfizer, which got approval for as a first vaccine for COVID. So the large-scale disruption was the impact of containment measures had a huge disruption on the economy at unprecedented scale and speed. The GDP in the US contracted 4.8% during the first 3 months of 2020. Compare this to the Great Depression in 1929, where the GDP has decreased by nearly 13% due to the 1929 stock market crash. COVID-19 has resulted, the stringent measures has resulted in unemployment increasing by 14.7% by the end of April. And in the first 6 weeks of the pandemic, 30 million new unemployment claims were reported, and 5.4 million lost health insurance between February and May of 2020. There were other indicators too, like lower electricity usage and lower mobility. So to counteract this damage to the economy, the US government put in place a stimulus package, an unprecedented stimulus package that valued at $2.5 trillion. And even then, the stimulus package was meant to provide stabilization rather than long-term economic growth. So it becomes an interesting question to study the kind of trade-off between economic effects and health effects, given the magnitude of the package and the number of deaths that are reported. So trade-off decisions are not new to healthcare. Trade-off decisions are being made every day in many different areas of healthcare, either by the physician at the patient's bedside, by regulatory agencies like Health Canada, FDA, when they are making approval to we provide approval for a new drug, as well as for HTA agencies when they're doing funding for new interventions. So when you look at the when you look at the cost for a study of this nature, it is difficult to quantify the exact cost because the ramifications of containment measures can be huge. So as a proxy, we use the stimulus package as a proxy for the cost, knowing that there are many other impact of this containment measures, including like effects on students, educational trajectory, impact of cancellation of elective surgeries, impact on mental health due to social isolation, job loss, and negative behaviors like gambling, increases in alcohol consumption. So there's so many things, but for the purpose of this exercise, we use the cost of the stimulus package as a proxy. So just a quick look at the two different packages that was put in place. The 2 trillion was put in place in March 27 and then followed closely in April 27 by another $500 million. And it was a very far sweeping stimulus package that covers quite a lot of areas. So here gives you a little bit of idea of what the stimulus package was going about, with the 3 main recipients being individuals, loans to corporations and small business, as well as to state governments for COVID-19 response. So how do we then measure trade-offs? So one way we could do it is to use a traditional method, like a traditional cost effectiveness method, understanding that most cost effectiveness analysis are really used to study single interventions from a payer perspective, and noting that there's really no rigorous standard regarding thresholds to represent good value for money from a societal perspective. So nevertheless, we thought that we could try doing a cost effectiveness and using the data that we had, and to see what kind of results, and open it up for kind of more like a discussion piece. So sorry, this slide is not coming out well, but basically a cost effectiveness ratio is really the difference in the health costs of an intervention before and after an intervention, divided by the health status before and after intervention. Basically, that's in a simplified form. So what would an intervention be? The intervention in our case for the study, we use the pandemic containment measures that are collectively put in place. So what will be the changes in the health status? Really is a difference in life years gains between the reductions in mortality, between a scenario where you had a containment measures versus a scenario where there are no containment measures. Sometimes I'm referring to a shutdown, but they are used interchangeably. So how can we go about doing something like this? Now, before we do the analysis, there are certain assumptions that come into place. One is that the distribution of deaths across the different age bands. And for this study, we use 8 age bands, starting from ages 20 to age 85. And we had to assume that the distribution of deaths will be comparable, will be similar under a no shutdown versus a shutdown scenario. And the reduction in life years lost is really based on, between the two scenarios, is really based on the current remaining life expectancies for males and females. That was done separately because they both have different life expectancy. And looking at model projections and looking at the difference, how much difference in the early death from a shutdown situation to a no shutdown situation. Because this study was done in the early months of the pandemic, there was a lot of models that were being used, both for decision making at the government level, as well as many projected models, epidemiological models. So we were fortunate to have that data at that time, though I'm not sure if you were to replicate this study now, whether those kind of information will be available that easily. Now, having said that, we use 2 main models. One is the model that's used by Imperial College London. That's a model preferred by the UK government. And that model projected between 2.18 to 2.78 million deaths in the US. There's also another model that was referred to in other press releases. There was a University of Nebraska Medical Center that estimate a much lower rate of 480,000 deaths in the absence, these are all deaths in the absence of containment measures. Note that this time when projections were being made, there was no vaccine done yet. So this was done in the absence of a vaccine and in the absence of any containment measures. So definitely there was a wide range of choices. And of course, we know now what the number of deaths are projected to be, but this is 1.5 years later. This was done very early stages where decisions were being made on containment strategies. So then how do we obtain projections of mortality under shutdown? So here we use the data from the Institute of Health Metric and Evaluation. This is data that was favored by the Trump administration at that time. And we used that because they were modeling what the number of deaths would be under containment strategies. And because the number of deaths were changing all the time, we had to use a cutoff point of August 4, 2020, where the model projected that there will be a plateau in the number of deaths. So that was our comparator that we have used for this analysis. So really now I can go through a little bit on the results, noting that this is really not a definitive answer, but really a what-if analysis, because we've used models that were available. We did not take into account quality of life, morbidity. Our cost is very much confined to the stimulus package. We had not taken into account many of the other costs, many of the other related costs that could be associated with this shutdown. So really, they are meant for discussion, for idea formation purposes, and maybe it could lead to a development of alternate methods, given that this idea has been brought up. So here is a quick kind of overview. If you look at the 7 scenarios, scenario 2 is the one I was referring to, was the University of Nebraska analysis. Scenario 5 and 6 were based from the Imperial College London. And then we added a few other scenarios on our own to bookend it. For example, scenario 1 and scenario 7. As well as some intermediate figures like scenario 3 and 4. We now know right now in hindsight that number of deaths in the US are nearing 1 million deaths. So we know the likely scenario was scenario 4, but at the time of study, we just provided a few scenarios and used some of it, well, published information from established organizations. So from here, you can tell that the incremental cost per life year gain is really varies very much as the number of deaths, as logically can be expected. The less the number of deaths, the higher the cost per life year gain. And then it gradually goes down to about 180, the greater the number of deaths. And this is measured against a 2.48 trillion package. So under the results really show that under no scenario for life years gain does a stimulus package compare favorably with other healthcare interventions that have favorable cost effectiveness ratio, at least of what we know now. So having said that, I'd like to leave the discussion piece now over to Eric to talk about how we interpret this and what can be concluded with this. So over to you, Eric.
Okay, certainly. Next slide, please. Next slide, please. Okay, so the most commonly referred to cost effectiveness threshold in the US is 50,000 per what we call quality adjusted life year, which was the cost effectiveness of the introduction of end-stage renal disease into the US Medicare system into 1970s. And that was the original cost effectiveness estimate used for that introduction into the system. We can inflate this by inflation rates up to current, to get around about 150,000 per quality. If you use the 50,000 as a price variable, we say the prices have tripled in that time. However, experiences in other sectors outside of health sectors should also be considered to make more definitive statements regarding value for money of the economic shutdown, because it shows, in essence, that with that kind of threshold, that there is probably unlikely that there is going to be a that there's unlikely that there's going to be cost effectiveness of these shutdown measures were likely to be cost effective. Next slide, please. So the value of a statistical life year is very useful, because it's not just with the healthcare sector, they're looking at 150,000 per life year. There are other studies that suggest in other sectors, such as one paper that looked at 35 studies that did a meta-analysis, found that it's about 428,000 per life year. An application to the environment, the VSLY, is equivalent to over $1 million per quality life year, and it even gets higher when you get into areas like space exploration or in the military theater. In Canada, the VSL was first estimated for public sector decision-making at 5.2 million as of 1983, and the VSLY associated with that is at least 276,000 Canadian dollars. It is thus possible that the cost effectiveness profile of the economic shutdown in the US was indeed favorable relative to VSLY's estimates outside the health sector. And when we consider this, could I go to the next slide, please? So beyond the cost of the stimulus package, there may be other cost considerations and factors, such as municipal and state and contributions to various measures, NGOs and various other charitable organizations out there that have contributed during this time. So those are not included in this analysis. Analysis also not take into account the decreases in quality of life. We just dealt with a straight out life year, and not every life year is the same as every other, depending on whether or not there's a decrease in quality of life associated with sickness and during that time. There are other ramifications, including mental and physical sequelae, including benefits and costs associated with short and long-term behavioral changes associated with the pandemic shock. And finally, there is great uncertainty regarding the range of death forecasts, given no other intervention concurrently in recent times had an associated wide range of subsequent impacts upon society. Okay, we can leave it to the question and answer now.
Thank you so much, Dr. Rebeira and Dr. Nauenberg. Fantastic presentation. We have about 7 minutes for Q&A. So just a reminder to all participants that you can ask your questions, and we will try to address them today within 7 minutes. So I see there's a few in there, but maybe I'll start with a question I have. And apologies, because it's not my area of expertise, but so I see that this was conducted in the earlier months of the pandemic. So if you were to redo this study again, how might it change, or will there be no change?
So one of the benefits of doing this study in the early months of the pandemic was because we had information from different models that projected the number of deaths coming up, because that was a time when COVID was rapidly spreading. So these are really established epidemiological models like Imperial College. We also had a number of deaths projected on a scenario where there's no shutdown. So because shutdown. So this was a very rare situation where we had both projections, no shutdown scenario and shutdown scenario. So when you are looking now, like we are on the tail end of the pandemic, you need to go back and figure out what would the projection be under those two scenarios, and whether you have stringent or very robust epi models that have done the projection under both scenarios. Notice we had that data at that time, so it was just like the timing was good. That's why we quickly did the study. So it could be very different now. So you may have to use a different method, and this is what I alluded to. Maybe not this method, but what method is really up for discussion.
Okay, absolutely. Thank you. Yeah, and so our next question here is, what improvements could be made to the stimulus package to better support the population? And is it feasible for a similar package to be used in the future?
I can go for that, and maybe Eric may have something to say. So one of the things is the stimulus package was very wide-ranging. It was hitting everybody at every time. So it wasn't a very targeted stimulus package. Literally everybody was getting it. People were getting cash payments. Going back in time, like looking now, there were some companies that even abused the loan system, like small organizations, large organizations. How much of stimulus package do you want to provide larger organizations? Like some industries do need that, like the airline industry, but the stimulus package, because of the speed at which things were happening, was more like desperation, like we have to do something. So it was very wide ranging. So perhaps if a stimulus package that was designed to be very targeted, specific to people who are unemployed due to the shutdown, or it's very targeted, it could be a different profile that we received. So this is something that we would actually some lessons learned from this package and from the way it was done.
Yeah, I do believe that if we went further on, it would get messier with many different things going on, particularly when you start to have vaccination available and various other things. Right at that particular time, things were relatively clean in terms of there was one stimulus package out there, and it was overarching. It was probably was the largest by far of any aid package that was available. If you can add it up, all the state and municipal and NGOs and various other things in the military that was going on, I think that this was far and away the biggest contribution towards the shutdown measures. And so I think that it was limited in the sense that things were cleaner at that time. To do it overall at this point, I think it'd be a much more complicated study.
Okay, so our next question here is, you discuss various trade-off factors, including value for money or cost effectiveness. Do you think there are certain trade-off factors that are more important or needed than others? Does this opinion change as we move towards a more endemic state of COVID-19? So whomever wants to answer that first can start.
So this study, it's really about comparing health benefits, trade-off between health and cost. So it's about life years saved between containment strategies in place and without containment strategies in place, and the cost which we use the stimulus package as a proxy. So yeah, if you want to have a more comprehensive study, you would look at all the downstream costs associated with the shutdown measures. And that's very hard to quantify. Research is only happening right now that shows about long-term effects, like long COVID, or the impact on education trajectory on students that had to stay at home and study, the impact of electives, delaying elective surgery. So there's so many components that it becomes so complex. So this is at a macro level, at the economy level. So we had to kind of define it. But yeah, you can do something, but you have to trade off the complexity of the model versus what you want to study, the question in study. So yeah, there's a way to really expand the study, but it can get very complex, and there's the more complex it gets, the more uncertainty the results get.
Okay, and Dr. Nauenberg, would you like to add anything?
I'm good with that answer.
Perfect. So the next question here we have is, how could these types of studies take into account the rate of vaccination of at-risk age cohorts that seems to be moving, a moving average?
I'm not sure the relevancy of that question to the paper. Maybe the person could rephrase and unmute themselves and give us the question over again.
Maybe they can write in the chat box, and then we can go on to the next question while we wait for that.
Okay.
So the next question we have here is, when you discuss the US package not being well targeted, would you say the Canadian one was better targeted? And do you have an idea of how the size of the package per capita compared to the US one?
Yeah, well, I mean, one of the things is that it gave out cash payments to everybody. the American stimulus package, whereas the Canadian packages were much more targeted towards people who are losing employment or businesses that needed to keep their wages, up during a time of a downturn in their economic prospects. And so the Canadian stimulus packages were much more targeted to certain sectors and to certain individuals, as opposed to wide-ranging cash payments to the population as a whole.
Yeah, and to add that the Canadian package, the package itself total $146 billion, and the vast majority of it either went to serve the Canada emergency response, like 35 million went to that, and the rest to wage subsidy through employees, 75 billion. So you can see it's definitely more targeted rather than out of 146. The vast 100 of it went directly to individuals because who are directly impacted by job losses.
Okay, well, it is 3:31, so we're just a minute over. So I just want to take the opportunity here to say, on behalf of the CanCOVID team, we'd like to extend our sincere thanks to you both, Dr. Rebeira and Dr. Nauenberg, for speaking to us today about the containment measures from our neighbors down south in the US. So thanks so much. And just a few announcements here before we end the session. Please join us at our next speaker series, March 29, from 3 to 3:30 on COVID-19 disinformation/misinformation among Black Canadians. And just a reminder that we have a CITF event tomorrow, March 23rd, from 11 a.m. to 12:30 p.m. Eastern Daylight Time on the importance of the pediatric vaccination. And so this concludes today's event. Thank you so much again for joining us today, and hope to see you at the next event. Thanks.
Okay, thank you.
We would like to thank our speakers and members of our network for their continued support and participation in Canada's pandemic response. If you are interested in learning more about CanCOVID or joining our Pan-Canadian COVID-19 Research Network, please visit our website at www.cancovid.ca.